Hey everybody, how are you? This is Dr. Redcross. I just wanted to stop by for a second. I drew a note for you guys, specifically for you. So today I'm kind of getting my nerd on. I wish I had my glasses, I'd push them up. And I wanted to just apologize to any nerds out there I may have offended. But look, I'm a nerd as well. We're the same. We're simpatico. Been called that all my life in medicine, but that's okay because we are going to nerd out today and we're going to learn. So as you look at this, I wrote here the Watchman procedure. Oh, I wrote myself a note here. Crazy cool, because it is crazy cool. So the reason why I decided to stop by for a second to talk about this is the Watchman procedure is something that's done not maybe for all of you who are maybe patients, but some people who have what we call atrial fibrillation. That is, becoming a little bit more common. If you know how the heart beats, everyone, the heart goes every time, right? Well, with atrial fibrillation, even for a fraction of a second, it kind of quivers for a second. Now, why is that a big issue? Well, it's a big issue because that little split second is enough to allow the blood to clot. And then the heart pumps perfectly, and then what happens? The clot is thrown, goes up to our carotid arteries and to the brain. It can be a stroke or other parts of the heart and causes a heart attack. So the reason why I mentioned this is because I was at the assisted living facility the other day, and as I mentioned, the patient's going to have this Watchman procedure, but I just had to stop because it's just the amazement and just the awesomeness of medicine and with what I do, and I'm so grateful and blessed to be able to be around this industry. So I like to teach, and so I just wanted you to understand why I thought this was, as you see here, crazy cool. The reason why is because as you see up here, but let me show you here. First, this is the heart, which my terrible artistry, okay? I know. You'll see why I'm in medicine. I'm not an artist, right? But anyway, as you see here, right here, everyone, that's what we call the right atrium. The atria are the top of the heart, right? We have the right atria, the right ventricle, the left atria, and the left ventricle. All right? So the reason why I did this horrible drawing was just to show you so it made a little bit of sense. As I was talking about with atrial fibrillation, in that split second, it can shoot up a clot to go up to the brain or somewhere else in the heart. But I also wanted to make note of this little area here. You see that little area kind of poking out over there like a horn? That's called an appendage. That's a part of the left atrium, that side of the heart. And when that blood clot can form, lots of times it'll come from that area where there's a moment of rest, the clot forms, the heart beats properly, gets shot up to a place that we don't want it to go to. Now, a lot of our parents or loved ones who have atrial fibrillation will be on blood thinners. That's the reason why they're on blood thinners, so that for that one point or that one stoppage or quiver doesn't become a clot and becomes an issue. Does that make a little sense? I hope so. And maybe this will make a little more sense. So because of that little appendage, now we all have them if we have kind of normal morphology meaning the way we were developed. The blood clot can form there. So the Watchman procedure, which is, like I said, my crazy coolness of it, is that the special cardiologist or cardiothoracic surgeon will bring in the catheter here. It'll bring that catheter here to the right atrium and kind of poke a small hole right here into the left atrium and bring that catheter and block that little appendage. Now, why would that be done? Why is that so cool? Well, because it blocks that appendage kind of with think about a stopper when we're doing a plunger. Imagine almost like a plunger being there, so that if you are having atrial fibrillation, which is that kind of quivering and stoppage even for a nanosecond, that blood doesn't go there and necessarily kind of hang out there and form and then goes out, if that makes some sense there. So that catheter, as it's floated here, a small hole here, I put a little dark spot there just to let you know that hole doesn't have to be patched. The way that the catheter works, it has what we call a sheath over it, so it kind of, when it's pushing it through and when you pull it back, it kind of closes itself. Double amazing, right? And so that's how that works. And so that Watchman procedure, Takes about an hour or so. So the big question you should ask is, well, Dr. Redcross, you already told me that my grandma or my loved one or what have you, they take something like Eliquis or something like that to keep my blood thin. So why would I have the Watchman procedure? Well, if your mom or dad or loved one is someone who has falls and they're at risk while they're on the Eliquis and they can bleed out and other problems and so forth, this particular Watchman procedure is something that can make a really big difference in their lives. Now, when you're thinking about all these sort of things that happen, as you know, with any procedure that we do in medicine or perform in medicine, there's always some sort of risk. But what we really have to focus on, everyone, is what we call the risk-benefit ratio. So in other words, if I have a patient who has had several falls, or sometimes I've had patients who have fallen and you can have a bleed in the brain and that sort of thing. If you're like, oh my gosh, that's the benefit versus the risk there, right? So while the Watchman procedure is a wonderful procedure for everyone, once again, it's for a specific kind of group of patients or who have other challenges with anticoagulation, we call it. That's what we call when we want to keep the blood thin. So when you have your mom or dad or your grandma or what have you, and they're going and they start talking about this Watchman procedure, hopefully you'll have a little more understanding as to what this is and why I think it is so amazing. Because look, back in the day of my training, these sort of things, they weren't necessarily invented yet and weren't used as often as now. So when you are hearing these things, you see how I drew this picture? Now, as horrible and horrific as this picture is, and once again, I'll let you know what this is. Very bad, by the way. Very bad, I know. But right here, we know this is the right side of the heart, the right atrium, the right ventricle, the left atrium, and the left ventricle, right? Once again, the heart beats, but with atrial fibrillation, you get a pause, a little quiver, and what can happen? The clot can form. The clot can go above where we don't want, strokes, that sort of thing, or other parts of the heart, other arteries in the heart can also be blocked, which we do not want either. So we have to be on blood thinners. One of the ones that I just mentioned was just Eliquis, because as I was talking with patients, it's used a lot because it's very effective, along with some other ones. But the Eliquis keeps the blood thin. But once again, grandma, granddad may be a fall risk. Grandma, granddad may not tolerate their anticoagulation well. Grandma, granddad may have had a GI bleed, meaning bleeding from the intestines or what have you in the past as well. So if they do have atrial fibrillation, something like the Watchman procedure could be a great option for them. There's other things they do for atrial fibrillation, by the way. You can use certain medications to help that arrhythmia, we call it, because atrial fibrillation is an arrhythmia. A meaning abnormal, ab from the normal rhythm. So there are certain things we can give some time to kind of, change that kind of short circuiting. It's fascinating because the heart has electricity in it that you make. That's why I say you guys are all amazing gals too. Very, very amazing. And so that's kind of where that comes. With atrial fibrillation, we can also do cardioversion, where we can kind of sedate you a bit, and the cardiologist will come in and use an electrical current to kind of get you straight again by kind of shocking the area. Very different than the paddles, clear. Not like that, but a similar sort of process to try to get you back in rhythm. So, and then there's some others too, but once again, I don't want to make it about that. I just wanted to make it about the marvel of medicine, show you guys that all of you are so important to me that I don't mind that you see this horrible, horrible diagram, and I apologize. Hopefully I'll get my guys hopefully we're going to give you a nice, a nice kind of cartoony thing so you don't have to worry about this. But the point is the reason why I wanted to really show this as well is that this is something that you can kind of bring into your doctor too. Your best with what's bugging you and what's bothering you and what's going on. This is the sort of thing I used to do with a dry erase board for patients to help better explain to you what you're going through, what you may need next, and how to best take care of you as well. So anyway, I am done getting my nerd on. Like I said, I don't have my glasses or else I'd push them up, you know, they always say. Anyway, the point is, I hope you guys learned a little today, and by all means, reach out if any of you know of this particular procedure for your loved ones. Dr. Redcross saying hello. Dr. Redcross is out. Talk to you. Bye-bye. Hey everybody, Dr. Ken Redcross here. If you don't know, I love the patient-doctor relationship. It is so important. So my question for you is, who wants to live longer? We all do, right? So therefore, I've written 2 books. This first book is called Bond. It's the importance of trust, respect, empathy, and communication with your doctor, because I believe if the relationship is perfect, then it will help you live longer. But how can I really make sure you live longer? Well, I decided to write a second book. This is the 15-minute Bond Blueprint. This particular book helps you go minute by minute of your 15-minute visit to make sure you get the perfect doctor relationship and visit that you all deserve to make sure we extend our healthcare journey.